Hi all, today I'll discuss about classification of mandibular third molar impacted teeth. First, Winter's classification, and the basis of Winter's classification is the angulation of mandibular third molar in respect to the long axis of mandibular second molar. So the basis of Winter's classification is the angulation of third molar tooth in respect to the long axis of the mandibular second molar. Let's see how it is. So if it's mandible, if it is a second molar tooth, then our classification of Winter's classification actually depends upon the long axis of the mandibular second molar. So this is long axis of mandibular second molar. So now if impacted third molar located mesial to the angulation is mesial to the long axis of second molar, that is third molar, if it is mesially located or mesially tilted in respect to the long axis of the second molar, it is mesioangular impaction. Mesioangular impaction. So in this clear picture, this is mandibular second molar. If third molar located mesial to it, it is mesioangular impaction. Just like that, this is second molar. If third molar located horizontal to it, then it is horizontal impaction. Okay, this is horizontal impaction. Just like that, we can easily understand all the classification of Winter. That is, this is again mandibular second molar. If third molar located vertical to the mandibular second molar, this is long axis, this is vertical to it, so this is vertical impaction. Next, if it is distally angulated, this is long axis, this is long axis. If third molar distally angulated, then it is distoangular impaction. Distoangular impaction. So we talked about mesioangular then horizontal, then vertical, then lastly disto-angular. Now if we give difficulty index value, Monsieur-angular is the easiest of all impaction. We'll give it value 1. Second most easy, giving value 2 to the horizontal, then vertical 3, and lastly most difficult impaction disto-angular with a value 4. So disto-angular is the most difficult impaction, and most easy or easiest is Monsieur-angular. In addition to those 4 classification, impaction may be Bucco-angular, impaction may be Bucco-angular, Lingo-angular, and inverted. So these 7, that is classification by Winters in 1929. Some high yield facts: Monsieur-angular is the easiest, disto-angular is most difficult, and most common impaction that we see day to day practice, that is Monsieur-angular. These 3 points you have to be keep in mind.